Hi everyone, I'm Mario Schlosser, the CEO of Oscar Health. I'm excited to be here today with Harry Ritter, who is the CEO of Alma, a network of mental health providers in New York City. And Harry and I would love to talk about the experience of getting mental health in this COVID crisis, how mental health has shifted from the office to the virtual space, who should think about perhaps getting help in the mental health space, et cetera, et cetera. Harry, great to have you on the video.
Mario, thank you so much for having me. It's great to be on with you this morning.
Definitely. Harry, do you want to talk a bit about what Alma does before we get into it?
Sure. Well, before I started Alma, I was lucky enough to work for you. I was at Oscar Health, and that was really where I fell in love with this space and wanted to build something in this space that I thought would make a big difference in the world. And now I think in a post-COVID world, more than ever before, I feel like this is really an important topic. So I'm grateful to you for both what I learned working with you and also the opportunity to talk about this subject this morning. We started Alma because we saw that there was a huge need for a better solution in the mental health space. This for me was an area that I think even in a pre-COVID world was an area that we needed a better solution. There was simply an inadequate experience, an inadequate provider network on the mental health side to service the need. And I think now in a post-COVID world, that's only accelerated more than ever before. A huge driver of that is that providers, mostly in the mental health space, are solo practitioners. They're small business owners. So now, in even more than before, they're experiencing a lot of challenge as a result of that. And they simply lack the support and technology to help consumers navigate care and be good partners to payers. So we set out to fix that. So as a business, we work with mental health professionals to help them build successful private practices so that they can focus on taking great care of their patients. We work with those who are seeking care to help them find providers. We work with payers like Oscar so that people can use their insurance benefits to see providers in network. And we're seeing that, and I think to your comment before, this is going to be a huge part of what comes next. I think the COVID pandemic is obviously deeply traumatizing our lives today, and there will be a mental health pandemic on the other side of this that we all need to be set up to work together to solve.
Can you talk a bit about what are you hearing from your providers right now? What is on people's minds? What has changed in sort of like the mental health states of folks across the United States?
I think there's three things that we're seeing. The first is the shift to virtual care. In our community before COVID, it was about 85% of providers were seeing all of their visits. 50% of visits were happening virtually. Obviously, now that number has flipped entirely. So, that's the current state of things, and that will evolve back to some kind of an equilibrium on the other end. But there's definitely a greater adoption of telemedicine, which is a phenomenal thing. It means that we're improving access, we're getting people in front of providers in ways that are reducing some of those barriers. So that's definitely, I think, one really important change that's happened in the space. The second is I think that there's a growing willingness to talk openly about mental health. I think the stigma was already starting to evaporate before COVID, particularly in places like New York and California and some of those markets. I think what you're seeing now is that really throughout the country, the conversation has really accelerated and people are much more willing to embrace the topic, acknowledge the need for care, and look for it. And I think the third thing is that there's a lot of empathy that's getting built. There isn't a person in this country today who isn't experiencing some form of anxiety, grief, or trauma as a result of everything that's going on around us. And I think that empathy muscle is being developed in a way that's really exciting and potentially transformative, not just in the healthcare space, but for all of us as a culture and as a society.
For sure. If I can ask there, actually, do you sort of have a simple heuristic, perhaps, for people to think about where you can get them some guidance as to when you can still cope with anxiety and stress and so on you have kind of in your own home and with yourself, and when you really ought to look for help from a professional? What is that line? When is it crossed, in a sense?
It's a great question. I aspire to a world where we don't ask that question in a sense. We say, look, in the same way that you wouldn't tell a healthy 35-year-old you shouldn't have a primary care doctor because you don't have diabetes yet. We should ultimately move to a world where we all have that sort of mental well-being provider who is there for us, because no matter what, whether it's childbirth, trauma, grief, losing a loved one, all those different things that happen in life, mental health should really be more than about remediation of disease, and also about building resilience and building strength. So I think that that's one aspect of this that I do hope evolves. In the moment, obviously, there is this question of when should you really seek help? I think that the general answer there is you should seek it earlier than you think. When you are noticing that the way that you're feeling, the way that your emotions are impacting your day-to-day life, and you're noticing that that's causing a negative impact on how you're interacting with others, coworkers, family members, that's the moment that you already want to have been starting to find the right person. And I think sometimes what happens is people ask a little too late. So they're already experiencing anxiety or depression or whatever it might be, and now stuck with the challenge of finding the right care, and that makes it almost doubly difficult. So I think my general answer, would be probably earlier than you think, to at least establish that relationship so you have it there for when you need it.
Right, and it's a great point, and I don't think that's again how the majority of people would think about getting mental health care these days, right? There's probably still a bit of a threshold internally you have to get over to really say, I'm going to seek help for this now from a professional.
And that's been the case for mental health over the last decades. I mean, if you think about physical health and you look back into the earlier part of the century, the notion of preventive care was not really prevalent. There wasn't really this concept that you as a young 35-year-old man should go out and establish a relationship with a primary care doctor, check your blood pressure, check your cholesterol, and so on and so forth, go to the gym, work out, eat healthy, right? These concepts were really concepts that came into the physical health world. And now, I remember when being at Oscar, how much emphasis Oscar puts as a company on being thoughtful about preventive health and getting your screening tests done and all those kinds of things. I think that's coming to the mental health space. And so I believe that within the next 5 years, and maybe even sooner, given I think some of this acceleration because of COVID, we will be talking about mental health as a part of a preventive services package that people should be really embracing to take care of themselves over the long run.
Yeah. Makes a lot of sense for sure. What is the equivalent, in a sense, of going to the gym and the kind of tips you would get on the primary care clinical sides, on the mental health sides, at the kind of different age categories, in a sense? Like, what do you wish you had known, had been told by a mental health professional when you were 20, 25 years old, that you would now benefit from, 10, 15 years later or so?
One of the spots that I think, there's a few spots. I think first of all is this notion of mindfulness. It's become very much a topic in sort of the consumer wellness space over the last few years. It comes in different flavors and it means different things to different people. We've generally equated mindfulness and meditation as one-to-one, but there's, I think, quite a bit more within the category of mindfulness that really people should have the opportunity to explore and be exposed to. Meditation is obviously one really valuable tool. There are other ways that I think people can develop mindfulness routines that I think can be extremely powerful and value add for people. The second area is, I think, really about community and connection. I think one of the things we see over and over again, and I was talking with one of our providers about this just yesterday, people who have strong community networks, who have built those support structures and have invested in those structures, have stronger resilience going through moments of challenge and moments of strife. So those would be at least two things that I think, I wish someone had said to me and sat down with me and said, look, as you go through life, make sure that you're developing mindfulness routines, ways of self-care, and developing those support structures.
Yeah, fascinating. And how old is you? Have 2 kids now, right?
3 now. I have a
3
third.
now. Oh my God, I missed the third one. That's great. Congratulations. Awesome. Do you do something different with your kids in around their kind of growing up in a better mental health state already at this young age that you picked up from your providers? Or
for my kids, where I think we've really tried to focus is on the expression of gratitude. I think obviously we want them to develop the social skills that will help them have support networks, and we try to create an environment for them that allows them to be mindful. But at that age, it's a little bit trickier. And the advice that I've gotten, particularly from our providers who work with adolescents and pediatric populations, is that one valuable tool for kids is to be able to start to verbalize gratitude as a way of building context and building a little bit of that muscle to be able to express oneself in a positive direction.
Yeah, very interesting. I mean, I think it's a fascinating field. Obviously, again, as you said, any adult likely is underserved right now or underseeks help from mental health professionals. It's certainly the case for kids, or even more perhaps the case than for kids. I mean, if you can start early in light ways of sort of like more systematically honing their skills of harnessing their mind and harnessing the emotions and so on, I think there's probably nothing better than that to prepare them for life, right? In the kind of growing mind of a kid, there is an opportunity of intervening early and then latching onto helpful tips and ways to kind of start growing into their life in even better way than the mind of the adults, right?
I think that's right. You develop these adaptive pathways and this muscle memory, so that when you're confronted with other kinds of stressors, you have that sort of superstructure to go back to and to leverage to help you figure out the path forward.
Someone who now thinks about seeking care for the first time, what are they getting into? Do they need to prepare for signing up for kind of right away a longer series of conversations to provide with a provider? Or is there sort of like a more lightweight way of orienting oneself, understanding what the kind of what the right interaction mode would be and how many kind of sessions and so on would follow from an initial conversation?
It's a great question. I think one of the biggest challenges in mental health space is inadequate attention up front to expectation setting and goal setting. Everyone needs something different, and there are so many different modalities out there that are designed to do different kinds of things. Sometimes the most appropriate intervention is a short-term counseling session or a set of sessions. Sometimes it's longitudinal care over a very long period of time. Sometimes it's intensive care for a period of time. So there are a host of different permutations that make sense depending on the clinical context. I think the most important thing that a prospective consumer, a client, a patient can do is ask the right questions and ask those questions up front. And set those goals. I think actually I learned that really from Charlotte Elkin, who is at Oscar, who joined me when we started the Oscar Center. And a lot of what she did really at the beginning in her intakes was try to understand, well, what is the need and what's the most appropriate course of action, and really work with someone before diving into care to establish those goals and that path forward. So I think the most important thing people ought to do is avail themselves of resources that are out there that can help them answer those questions and establish those goals and expectations so that they're set up for success. We do that through our client matching service. So people who are looking for providers within the Alma community can work one-on-one with our client matching team. And that person really is there to say, well, what are your goals? What are you looking for? What's the most appropriate modality for you? And then provide you options that might be a good fit and help facilitate that match. And I think that helps. Care navigation at Oscar similarly, I think, provides that layer, especially for people who are new to therapy, who are nervous about what it will mean to engage. Starting with some help makes a big difference.
Yeah, really interesting. Can you maybe give some concrete examples for types of patients, types of needs you would match with which types of providers, so people can give a bit more of an idea of, oh, I am like this, and understanding what kind of care they would get?
So I think when you look at matching, the first biggest challenge that people have is affordability. So I just want to call that out before going into the clinical, what matches to what. And one of the big challenges today is access to in-network providers. So one of the things, obviously, we're really proud of at Alma, we're in network with you guys. We're growing our provider community every day. We're adding new providers to the community so that people can use their network benefits, the amazing benefits that you have as an Oscar member, to see providers within the Alma community throughout New York, the region, and soon also in New Jersey. So I think that's a really important sort of starting point. And I think in some ways, the second order questions are almost luxuries that many people don't even get to ask because they can't afford it in the first place.
Right. Yeah.
When you do get to the spot of what makes the most sense for people, I think there are certain categories where it really helps to make sure you're working with someone who has done it before. Particularly, one example I'll share is in the postpartum or peripartum period. Particularly right now with COVID, I mean, we had a baby 4 months ago. I can't imagine what that experience would be like in the last 2 months or in the next few, in terms of just the uncertainty and the fear that comes with that. So finding providers who have experience in that category and have expertise in that category will make a big difference and will definitely be a helpful thing for people to look for. Grief, trauma, sexual identity, those are, I think, other categories where looking for providers who specifically have had experience in training makes a lot of sense. For most people who are experiencing some amount of trauma, anxiety, depression in the context of everything going on, the key is really to find the right match for you. So there are definitely different styles that providers can bring to the table, whether it's CBT or psychoanalytic or so on and so forth. But for a consumer, I think the better thing to do is to try to find a provider where you feel that you will have a strong therapeutic alliance, where you feel that you can develop strong empathy and connection. And what we see, especially among providers now, is that the modality and the provider will match to what the client needs if there's empathy and there's therapeutic alliance. So my approach is generally, first, make sure that you're finding care that you can afford, because if you can't afford it, you're not going to be able to use it. Number two, if there are certain categories of things, particularly things like postpartum or peripartum care, sexual identity, grief as a few of those categories, look for providers who have experience. But if it's the majority of people who are experiencing depression, anxiety, some amount of trauma from things that are going on in our world around us, look for match. Look for that therapeutic alliance and a clear set of goals that you can establish with provider, because that's ultimately what's going to predict outcome.
Speaking of affordability, which still continues to be the number one issue in the US healthcare system, and which we at Oscar work very hard on, making sure we give people more affordable options of healthcare. If someone was only able to afford an initial conversation, an initial consultation, is that still worth it? Can in one consultation, a mental health provider, get to the point where he or she can give useful advice and really say how much and maybe more consultations could help? Or do you need right away more than one conversation? So in other words, do you encourage people to really at least seek out that initial conversation, or how to think about that?
It's a good question. I think it's always good to have that first conversation. First of all, because it itself is somewhat therapeutic. Having the opportunity to speak to someone about what's going on is itself of value. It may not provide lasting benefit or so on and so forth, but I think it can be of value, particularly in a moment like right now. Two is, I think it creates an opportunity to understand what is available to you. Most consumers who are naive to mental health care simply don't understand what it is. Maybe their image of mental health is The Sopranos and Tony Soprano on the couch kind of a thing, and they don't have an understanding for the different choices and options that might be available to them. So it's a useful thing to have that conversation to develop better understanding and understand what your options are. And then thirdly, I think providers should be in a position to at least point people in the direction of resources that can be useful, even if they aren't therapy itself over the long run. And that goes back to some of the things we were talking about before. How do you develop resilience, mindfulness routines, support networks, right? Where are the ways that people can get connected to things like that? So my suggestion would be always take the first step. You won't do any harm. You'll learn, and you'll hopefully develop a clear picture of the best path forward for you, depending on your individual circumstances.
Yeah. Okay. Great. Now, what are things you do for your own mental health outside of perhaps seeking out from the professionals, but sort of like day-to-day tips for staying fresh and keeping top of family life? And obviously you're a CEO of a growing company as well. That must be stressful in its own way. So can you share some tips there?
I'll tell you, Mario, I find it's hard now. And I think this is what a lot of people are experiencing, because so many of the things that I leaned on, if we were talking a month ago or 2 months ago, are much harder right now. So, two examples. I think physical exercise. right? Getting out there, exercising, using your body, blocking that hour a day or hour two or three times a week, just to go for a jog and listen to music or go to the gym, right? It's much harder right now than it has been before. Another classic, thing that I think about is social community. The three things that I've been trying to do. One is trying to block some amount of time every day to just be still, whether it's through prayer, through meditation, through something like that. And for me, that's every morning through prayer and having a little period of time where I just sort of shut down, everything's away, and I take 15 to 20 minutes to just be. I think that helps a lot. Two, trying to find ways to keep physically well. We're all stuck in smaller spaces, but trying to find those new routines that work. I started jogging again, which I hate doing, but I'm doing now because that's the only way that I can interact with the outside world. And it's good. It's been great. And then thirdly, I think trying to find ways of replicating that social support. So, Zoom, my mom's out in California. She's by herself. Trying to find more opportunities to be on FaceTime, to be on Zoom. It doesn't do the whole job, but we do have tools to avail of ourselves that we can try to take advantage of. So that's at least what I've been trying to
do. For me, what I always notice that kind of gets my mood back up is some kind of creative pursuits, in where I can wander around a bit. And that may honestly be in Excel spreadsheets, as weird as that sounds, but that has a certain therapeutic effect on me. If you sort of like build something, put something together, and you finish it off, and that's a nice thing. But then on the other hand, you also can't be too hard on yourself in terms of then wanting to finish that off. I think sort of embracing the imperfection these days, unfortunately, is something I think we all have to learn. So
there was a great piece in the New York Times about 2 weeks ago on the subject, where it's saying people were now getting more stressed out because they were home and they thought, well, I'm going to do all of these things, and now I'm not able to accomplish any, and now I feel like even more of a failure and more. So I think that's exactly right. One spot where we've been doing a lot with our kids is cooking, because that's sort of nice. It starts and it ends, and you have to eat it. So it's a very kind of time limited task, and even there you end up burning all of your cookies and you feel bad about it. But the process itself is, I think, very therapeutic and useful.
For sure, that's a great point. I actually think the other thing that I think is worth reflecting on there as well is, why does it take something like this for us to all now suddenly say, oh, now I can really bake more cookies, or now I can really build a video game or something like that? It shouldn't have needed a cataclysmic event of this sort for us to kind of jog our brains and jog our memories to start to say, maybe I can spend my time a little differently with my kids. Maybe I can do some different things with my family or with friends as well. It goes to show that I don't know if this fits in the topic of mindfulness as much, but it goes to show that even in normal days, we just kind of get sunk into our day-to-day patterns too quickly, and that in of itself can be not a good thing either, right? The old saying of one of the best things you can do for your mental health is to take a different way to work every day. Obviously, if you can afford that from a timing point of view and from a sort of like logistic point of view, but that by itself already sort of puts your brain in different patterns, and I think keeps it a bit more fresh, and otherwise would be the case, right?
I think it'll be interesting to see, it's very difficult on days when you're seeing in your city that you love, these death tolls and the suffering and the challenge that's going on to look for silver lining or try to embrace silver lining. I think it's a difficult thing to try to do, but I think we have to, in a certain way, to be able to, find some value out of it. I mean, it can never be worth it, but to find some value out of it, I think there are some things that could change fundamentally about how we all interact with each other forever, that if we can take advantage of those things, like you're describing, it will make for a better world on the back end of this once we all get through it together. And I know we will. It's just a question of people like you and people out there who are, in the healthcare space and broader economy, continuing to provide the leadership that we need to get to the other side of this, and take care of one another through the process.
No, I think that's exactly right. No, I think it is an opportunity. I think that's right. I think we are obviously trying to work extremely hard to make sure members are covered. We help members navigate the healthcare system, and we build new benefit designs and new ideas and things like that. I think the people on the front lines of this are obviously the real heroes here. Folks in the hospitals, folks in the physician practices. I mean, nothing compares to that. So I'm glad that we
I'm so humbled by our community. We've been doing these, regular support groups and webinars and education sessions for providers. That's really why we exist. So, as a company, I think as a doctor, I really wanted to start a business that was provider first. I've always felt very passionately that these incredible individuals who dedicate their lives to taking care of others deserve our support. They're the people who are out there actually doing the work at the front lines day in and day out. And that's really, that underlies everything we've done at Alma as a company. We exist to help providers because we believe that only by helping them can we create a world where people can get the care that they need. And that's, talking to them and seeing what they're going through at this moment. And, one of the things we've been talking a lot to our providers about is how do you take care of yourself first? Because only then can you take care of others. And then how do you take care of others? Because, man, they need you. This is the moment when we all need to rally behind you, the providers of care, and make sure that you have what you need to do it, because you're the key to this.
Yeah, I couldn't agree more. So, Harry, it seems that one of the things we talked about earlier is that really almost all of the, or pretty much probably all the conversations that your mental health professionals are having now at Alma have shifted from probably mostly in person before to now probably entirely virtual. First of all, how has that gone? How has that worked? And then second of all, are there tips you can give to members who want mental health care on how to get the most out of a ZoomBase, psychological counseling session?
Providers have been really impressively adaptive in terms of making that transition. We've actually seen, visit volume accelerate quickly through the last few weeks as people have been really seeking care and getting access to care. But a total flip, as you pointed out, from 85 to 90% of care happening in person to now 100% of care happening online. So I think that switch has happened very very quickly, and I think providers have adapted very well to it. There are definitely things that are new in the space. So we've been spending a lot of time with our community through webinars and other education and training resources to help them make sure that they're doing it well. An example is setting, right? Making sure that you're in an appropriate setting. But there's also clinical challenges and benefits that come with teletherapy. So an example, if you're in an abusive relationship and now you're in quarantine with that person, how do you seek mental health care, right? And so, working with providers to identify creative solutions, like having the person go for a walk in the park, or taking the call from a bathroom or a friend's apartment, or how are we sort of navigating some of those challenging cases? But then also looking at the advantages. There's something about taking a call from your home that's almost feels safer, right? You're in your own environment. You're almost letting someone into your world in a way that accelerates intimacy in a way. So really working with providers to identify those opportunities as well. So I think we're in a moment where providers are adapting quickly. We at Alma are working very closely with our providers to make sure that they have the tools, the learning, the education, the resources to get trained and understand these nuances and take advantage of some of the opportunities that I think do emerge from where we're in today.
Let me actually maybe ask a different question as well. So I'm from Germany. As you can tell from my accents, is there something different between different cultures and backgrounds that would make for a very different approach to mental health counseling?
It's a really important question because cultural competency and understanding cultural nuance can play a critical role in care. And it exacerbates, I think this factor exacerbates some of the disparities in access to care. If you look at the mental health workforce, while it is a big group of people and growing very quickly, it's predominantly white, predominantly female. So even as across more conventional distinctions between people, there's homogeneity within the community that sometimes can make it harder for people to find what they're looking for. I think it's definitely important for providers who are caring for different communities to develop competency and to take the time to really understand and develop and understand those specific nuances. So that's absolutely very important. And I think in many instances, it is really important for people to be able to find providers who are more like them or come from a similar cultural or socioeconomic or racial background. So I think those are really important factors. It's particularly challenging, I think, in the African American community and the Latinx community, where you simply don't have as many providers as you'd like, and also where the stigma may be stronger. And I think that's a big challenge that the industry needs to tackle. We spend a lot of time thinking about that at Alma, trying to make sure that we are bringing together a community that's diverse, because we're a larger community, we can try to find the right matches for people and help them find that person who can understand their specific circumstances better than maybe others might. But it's a structural challenge in the mental health space that I think will get better as we continue to train new clinicians, both making them more culturally competent and then making sure that we're training up a diverse community of providers in the future.
Okay, very interesting. I'm looking forward to working with you on that topic as well. I think that's just incredibly important. We notice certainly that the approach to healthcare, the approach to customer service, the approach to finding people providers is really so incredibly deeply rooted in cultural backgrounds and quite different really for different cultural backgrounds. That's often a missing piece, I think, in the delivery of healthcare. That's we at Oscar certainly are doing a lot of work on, want to do a lot more work on as well in helping solve. The almost like more of a scientific question there. Do you see like a difference frequency of application of different psychological approaches, like CBTs more in Germany or whatever, in different cultural backgrounds, or is that?
No, we haven't seen that. What we find is that, and it's interesting. We're all humans. Everyone has the modalities, the psychology. But there are definitely cultural frameworks, cultural references, understanding the evolution of certain kinds of relationships. A lot of that more, the relational kinds of components that are very much culturally specific. But the modalities generally are consistent, at least in our experience.
Okay. It's a good sign actually for then, I would hope, the scientific rigor of the space, right? Because ideally the modalities reach into the depth of the mind in a way that is independent of the cultural implications, but then the various ways in which you can connect this to the conversation with the member, with the patient, maybe that's then influenced by the culture. And
I hope that that's right. I mean, the risk is on the other side, that it's just because we haven't studied it enough, or because we don't get exposed to the research enough, that we don't appreciate these nuances and differences. So there is that risk on the other side. But I think, it seems to me like it's more likely to be exactly what you're describing. It's a question of how can you adapt the modality in the context. And that's really where I think mental health is unique. I think sometimes, if let's say you come in with strep throat, so there's an algorithm that you execute when someone comes in with sore throat and spots on the back of their tonsils that is consistent whether, wherever you are in the world and whatever background you come from.
Yeah.
And when it comes to the application of a mental health modality, it's much more nuanced, it's much more personal, it's much more intimate. And I think that's where this makes all the difference.
Awesome, Harry. Thanks a lot for the conversation. Really good to see you.
Great doing this. Awesome seeing you. Thank you very much for having me, Mario.
Yeah, see you soon.